Hello friends, welcome to CNS Viewpoint. Today we are going to talk about a very important scientific study which was published in the weekly morbidity and mortality report of CDC, US CDC, the Centers for Disease Control and Prevention. So friends, in this report they looked at data of over 600,000 people in 13 states of United States, and they found that the risk of getting infected with coronavirus for fully vaccinated people was 5 times less than the risk to those who are not fully vaccinated. 5 times less risk if a person is fully vaccinated of even getting infected with coronavirus. 5 times less. Number 2, they also saw that the risk of getting serious outcomes of COVID-19, which include hospitalization, oxygen requirement, ventilation, etc., was that risk for fully vaccinated people, if they get COVID-19, was 10 times less than compared to those who were not vaccinated. Number 3, the risk of dying of COVID-19 for fully vaccinated people, if they get infected with coronavirus, was more than 10 times less compared to those who were not vaccinated. So this study was done during April 2021 to July 2021, and they looked at, as I had said earlier, data of around over 600,000 people, and in 13 states of United States. So this is an important trend, important data, important inference, that 5 times less infection risk, 10 times less hospitalization risk if COVID-19 happens, and 10 times less risk of dying if a person is fully vaccinated. So friends, it is not up to a person whether he or she is fully vaccinated or they are fully vaccinated, but it is up to the health system whether people are fully vaccinated or not. So again, let us hope that vaccine rollout becomes more equitable. All rich and poor countries, all communities, whether rich or poor or marginalized in any possible way, each one of us, each human being who is eligible for vaccination against COVID should get access to all WHO approved and accredited vaccines, evidence-based vaccines, so that we can together, the only way out of the pandemic is together. We can together make the world free of COVID. The only hope that right now is that if the entire population in the world, a significant part of the entire population in the world is fully vaccinated within a stipulated period of time, we might see the end of the pandemic. And individual benefits, CDC has already highlighted that 5 times less risk of infection, 10 times less risk of serious outcomes, and more than 10 times less risk of dying of COVID-19 for fully vaccinated people. So friends, let us push our governments to make sure that the vaccine rollout is equitable. With these words, we'll conclude today's viewpoint, and tomorrow again at 5 p.m. we will be back with our thoughts and views and perspectives on another issue that touched our hearts and minds. So stay safe, and please, for those who are eligible and not yet fully vaccinated, please go get a jab. Thanks a lot. Bye bye. See you tomorrow, 5 p.m. India time.